This is Mon Health Talk, a weekly program focusing on the dedicated physicians, nurses, and staff at Mon Health, the region's premier community hospital system. People with skillful hands and bright minds using state-of-the-art technology. We don't just practice medicine, we care for people like family. That's why at Mon Health you can feel the difference. Once again, welcome to this edition of Mon Health Talk.
Good morning. Welcome into Mon Health Talk. I'm Dave Wilson. My guest this morning is Dr. Sam Mathur, ENT Services. That's ear, nose, and throat services. Dr. Mathur, good morning.
Good morning.
I appreciate you taking some time. We'll get into the topic in just a moment. But first, let's talk about you for just a couple of minutes. Tell us a little bit about your background, where you're from, where'd you go to school, and how'd you end up with Mon Health?
Sure. I'm originally from Western Pennsylvania, raised in Cambria County, Johnstown, PA. Did training in Boston and my ear, nose, and throat training at Duke Hospital in North Carolina. Moved back to the area after my training in 1998 and have practiced in 3 different locations in Western Pennsylvania, and primarily based in the Pittsburgh suburbs in the past 12 years. And just recently, approximately 6 months ago, opened our location here in Morgantown.
So what drew you to your specialty in ENT services?
No, I really enjoyed surgery. However, I really also enjoy my time evaluating and working with patients, treating them in the office as well. And ear, nose, and throat was the perfect blend of those two things. We do a variety of surgical procedures. We take care of a variety of patients and age groups. But yet we do spend a lot of time in the office with patients, treating them medically as well. So for me, it was the perfect blend of both of those.
Dr. Sam Mathur is our guest this morning. We're talking about ENT services. So what kind of, or what would people typically come see you for to have you treat?
Like I said, we treat a variety of things. That one of the most common things that we see patients for are problems with chronic sinus problems, nasal allergies, snoring. We deal with a lot of problems with the throat, chronic sore throat, chronic tonsillitis, trouble swallowing, ear problems, of course, ranging from ear infections, ear pain, to more hearing loss and things along those lines. Unfortunately, we do deal with some of the more serious issues as well, such as growth and tumors of the head and neck area. So a very wide variety of things. We like to pretty much say everything from the collarbone up, except for inside your brain and your eyeballs.
Everything around it, though, you're going to be able to take a look at and help us with. You mentioned sinus infections, and that was one thing I dealt with as a kid. It seemed like there were a couple of times a year, spring, late fall. As it turned out, around Christmas time, because we had a natural Christmas tree in the house, as it turns out I was allergic to, we learned later. But are there some times of year when you see sinus infections and sinus problems actually increase?
Well, unfortunately, we are kind of in the sinus and allergy belt. And like you mentioned, allergies can be a very common trigger for people to develop sinus infections. So that's going to, from an outdoor standpoint, obviously be worse in the spring and late summer, early fall. But we just see a lot of sinus infections in the winter in general, just because of the increased number of other type of viral and upper respiratory infections. Frequently, sinus infections will be triggered by even a chronic upper respiratory viral infection that doesn't completely clear up. And frequently you'll hear people say it started as what we thought was a cold that was going around, and then I got really sick and it got worse, and then I had to go to the doctor and get antibiotics. And so really it's all year round. It is a little worse in the spring and the fall, probably because of the allergies.
What are some of those typical telltale signs that you're having a sinus infection or you have a sinus infection?
Yeah, and that can be a little bit tricky. So one of the things that we really want to be able to distinguish is, first of all, whether it's just your allergies acting up or it's a sinus infection. People with very bad, severe nasal allergies, it can be tricky to tell. However, generally, you're going to feel ill if you have a sinus infection. You're going to have a lot of congestion, may or may not even have some pressure or pain in your cheeks or in your forehead, frequently a sore throat associated with it. Then most often, most people will get at least a low-grade fever. A lot of times people get caught up in whether they're blowing out clear stuff or discolored. And sure, if it's really discolored and yellow and green, you probably do have an infection. But frequently, even with an infection, that isn't always the case. And then to be able to tell that apart from a viral infection is really difficult in its early stages. We really usually say that if you're not starting to feel better or dramatically improving 4 to 5 days into the beginning of your significant symptoms, it's probably more a sinus infection than just a regular virus.
So just because you may have a sinus headache, a sinus pressure, that doesn't necessarily equal infection. You can have one without the other?
Yeah, people with anytime your nose gets very congested, and that can even happen because of very severe allergies, it can result in a pretty significant pressure sensation in your forehead or in your cheek sinuses, below your eyes as well. It does tend to be an indicator of an infection in some situations, but it really doesn't tell. Isn't a very good sign to be able to tell a sinus infection apart from just a bad cold. It is more sort of the whole picture as well as how long it's lasting. Most sinus infections have a longer duration, and therefore 3 to 5 days of worsening symptoms usually indicates that you should see a physician at that time.
Dr. Sam Mathur is our guest this morning, ENT Services with Mon Health. And when do you know, or as a physician, when do you start looking at different treatments from someone who may have some allergy-related issues to someone who may be suffering from chronic headaches, chronic sinus pressure, the type that just no matter what you do, never goes away? How do you distinguish that, and then how can you go about treating that?
Well, that's an excellent question. It's duration and intensity. What we normally tell people is the average person gets somewhere between 0 or 1 sinus infections a year. That varies, obviously, a lot. So everyone's going to have these episodes. There are few people that are lucky and never get sick, essentially. But really, the people that have multiple episodes, whether they call them colds or sinus infections, that are significant in their symptoms, or they end up seeing, through an urgent care or their primary care physician, or seen multiple times per year, that's not normal. Also, people that get sick and are sick for an extended period of time, that is a so-called cold that doesn't get better for, 7 days, 2 weeks, have to take more than one course of antibiotics from their family doctor to improve. That gets into a category that needs to consider being investigated by a specialist, because there may be a structural problem or a blockage somewhere in their nose or sinuses that's making their condition more frequent and making it worse.
Talking to Dr. Sam Mathur this morning, ENT Services with Mon Health. Got to take a break. We'll be back for more of our conversation in a moment. You're listening to Mon Health Talk on WAJR.
Now back to Mon Health Talk, a discussion of the issues, people, and procedures in healthcare today. If you have a question for one of our healthcare guests, call now at 304-296-0041.
Our guest this morning, Dr. Sam Mathur, ENT Services with Mon Health. And Dr. Mathur, is there anything we can do when it comes to sinus infections to prevent them, or sinus pressure, allergies overall? Can we do anything to prevent the impacts?
Yes, definitely. Particularly with allergies, which is a very frequent trigger for the sinus problems and infections that we see. Treating the symptoms with antihistamines, the allergy sprays that are frequently found out there, most of which are over the counter, can be very helpful in decreasing the congestion and swelling in your nose to keep you from getting as backed up or as congested. In terms of getting sick, obviously just your standard precautions of hand washing and staying away from people when you're sick or when they're sick, but also going to the doctor. You know, I want to emphasize that if you're not getting better in 3 or 4 days and your symptoms are significant, you're going to need to be checked to make sure that you don't need treatment, because too many people wait too long before they see a healthcare provider, and then frequently the infection is settled into their sinuses and either takes a long time to clear up or can take multiple courses to clear up. When that happens too often, you're going to end up with a chronic condition.
Dr. Sam Mathur is our guest this morning. We've talked a lot about sinus infections here during the course of the show, but what are some other common ailments with regards to your nose and throat, obviously, that you see this time of year?
Well, we start to see some of the chronic sore throat and chronic tonsillitis type issues in the fall when the kids get back to school. The peak season for that sort of coincides with the cold and flu season, December through March. In the younger age group, infants up to 5 or 6, we'll start to see some ear infections, but that really is predominantly a winter phenomenon. We're still in the heart of the allergy season, so in terms of illnesses right now, we're probably still seeing more sinus infections than we are the ear infections and chronic tonsillitis yet, but that will be starting soon and usually lasts well into the early spring.
It sounds like, just talking to you here for a few minutes, what you see and what you're treating really is based on the time of year, whether the pollen is blooming or we're all stuck inside and passing around different ailments to each other. It sounds like it can be very cyclical.
It is. It's very cyclical. And what really defines our specialty is, of course, these things that we're talking about are very common ailments and are probably the most common reasons that people will call their primary care physician or present at an acute care, walk-in type clinic. And so really what we try to do in our specialty is define for the patients and also for our primary care providers, when is it bad enough to go see an ENT? And so that has to do a little bit with the frequency and severity of the symptoms, because what we can offer is, and what we look to try to offer, is a long-term solution to that person's problems. We can't put you in a bubble and make sure you never get sick, but if there's something structurally wrong with your throat, for example, your tonsils are chronically enlarged or infected, you're going to be more prone to get those sore throats. If you have a deviated septum in your nose or blocked sinuses or nasal polyps, then these sinus infections are going to happen more frequently and more severe, and you're going to end up at your doctor's all the time. And that's what we try to identify and see if there's something that we can do to fix that or to make it much improved for the individual patient.
I know there are probably at least a few wives out there listening right now thinking, is this the guy I need to send my husband to? And I'm picking on us guys because he snores all night long. Are you the guy? And is there anything that can be done to help that situation?
Well, I could be the guy, yeah. Snoring is a complex problem and can be caused by a variety of factors, but a very common factor is the inability to breathe through your nose. And if you have a lot of congestion in your nose, you're going to snore, regardless of what position you sleep in or exactly how much you may weigh, et cetera. And also snoring is important because it can sometimes be a sign or a symptom of a more significant medical problem, such as actually sleep apnea, where you're not getting enough air when you sleep. So frequently, yes, that's not uncommon for someone to be in our office because their wife recorded their snoring at night and comes in with them and plays it back for me on their phone. Not all these situations can be fixed, but many times they can either be fixed or significantly improved upon. Yes.
And that goes back, that's a quality of life issue for, well, everybody involved, right? And there are several of those that, folks talk about it, and it makes everything better. It improves everything to address issues. I don't know, we kind of chuckle there about the snoring, but it's a quality of life issue for a lot of people. It really is.
It is, and also it's become fairly common now to identify snoring as potentially sleep apnea, which is a good thing. However, one of the things that I want to emphasize is frequently people will be sent to a sleep specialist or a sleep clinic. They may be diagnosed with what we call obstructive sleep apnea and recommended for a CPAP or a positive pressure mask. And one of the things we see as ear, nose, and throat doctors is many people don't use it or have a hard time wearing it or use it for a while and then give up on it. And one of the things that can lead to that is they can't breathe through their nose, or the back of their throat is really blocked. And the machine is perfectly fitting and is exactly what they need, but it just doesn't work because they can't breathe well enough through their nose to actually wear it. And so in some cases we can cure your snoring. In other cases we can make your nose work better so that you can at least wear your mask if you actually have a more significant medical condition such as sleep apnea to be able to treat it. So, yeah, I mean, it's important.
All right, this question may sound silly, but I'm going to ask it anyway. Q-tips, are they bad or are they good when it comes to your ears?
They're always bad. I can't come up with a reason to use one in your ears.
So how do you clean house there properly?
Well, let me just tell you why they're bad.
Sure.
The diameter of your ear canal isn't a whole lot wider than the end of a Q-tip. So even if you're feeling good about yourself because you stuck it in there and you see what you think is some wax on the Q-tip, you've taken the majority of the wax and just driven it further down in your ear, and then it just makes it worse. So the best way to treat an earwax problem, if there is an earwax problem, is to use one of many available over-the-counter earwax softeners and removers that you can get at any of the local drugstores. For example, Debrox, D-E-B-R-O-X is just a trade name, very common one, but there's many. And the idea there is to loosen it up and basically most of the time to clear enough of the wax out of there that it doesn't block up your eardrum and affect your hearing.
I think this is the first show. We've been doing this show for a couple of years. I think this is actually the first ENT Services show we have done. Services like yours, they seem to be a little bit limited in town, so how can folks get a hold of you, and where can they find you?
They are a little bit limited, and that's what we're trying to repair and try to make better. Well, we are at the Mon Health Park Drive in right off campus. And we are there on a regular basis. And the best way to reach us is through monhealth.com, or you can call us directly at our number, and that is 724-799-8014. Because this is now a new location, that number still is a Pennsylvania number, but just specify that you want to be seen in Morgantown, and we'll be able to schedule appointments for patients. And we're looking forward to be able to start treating patients. And there are other ENT services in town through the university, but sometimes they're limited, or sometimes people need a choice of more than one place to go to. And so we're hopefully going to be able to get people in quicker, give them a different viewpoint, and take care of their needs.
Dr. Sam Mathur, ENT Services, Mon Health. Dr. Mathur, appreciate it. Enjoy the conversation. Thank you so much.
Thank you very much. Appreciate it.
Absolutely.